So you join us at the Advanced Therapies and Regenerative Medicine Congress 2019 here at the Business Design Centre in London, and I'm joined by two people from Cryoport. I have with me Jerry Shelton, who's the Chief Executive Officer, and Mark Sawicki, who's the Chief Commercial Officer. So tell me a bit about Cryoport.
Cryoport is the world's most trusted cryogenic logistics provider to the life sciences. Actually, we're moving more into temperature control logistics for the life sciences. We support three markets: biopharma, animal health, and reproductive medicine.
And Mark, tell me, what are the particular problems, since we're here at the Advanced Therapies Congress, what are the particular problems that are faced in delivering advanced therapies?
So advanced therapies are extremely fragile materials. So a single temperature deviation of this materials in transit will destroy the product. And the challenge with regenerative medicine is all of these therapies, the majority of them are single patient specific materials for immunocompromised patients, where if there's a failure, you kill the patient. So there's a zero tolerance for failure. So we have to be very risk conscious and very exacting in how we ensure that we move these materials from one location to another.
So you can't just send them out via a regular courier?
Absolutely not.
As if they were an Amazon parcel.
Mm-hmm.
So this is a big issue. We can see just at this Congress, an enormous number of new therapies that are now coming on stream. You also have a new product come on stream. Tell us about your wonderful blue box.
I'm going to defer that to Mark because he's the
blue box man.
He's the champion of that new revolutionary shipper that we've put together.
So the new product that we have is called the Cryosphere. And the Cryosphere is unique in the space because it eliminates many of the in-field risks that a given package would traditionally be exposed to through untrained personnel handling a given piece of equipment. And so it gives our clients better control on managing the risk when it comes to temperature excursions, mishandling and damage to the product due to mishandling, as well as security of the product itself.
Because the guys who are moving the product don't really know anything about it, and they can mishandle it. And we haven't really moved on in our cryogenics since the thermos flask in some ways.
Oh, this is an evolution. I mean, we have moved on considerably. All of our shippers are designed to be shock-proof and shock absorbent, and we handle everything with great care. The Cryosphere is simply a prototype that we're introducing right now that has to be developed into a functioning product that we will have in the marketplace. The beauty of the Cryoport is the Cryosphere is it has several dimensions. First of all, as Mark said, it's never in a non-upright position. It
wobbles on a...
It wobbles on a suspension, and it never goes out of being in the upright position. Therefore, it's always a functional piece of equipment. The second thing is we communicate more intensively with that piece of equipment than any piece of equipment that anyone has in the world. We actually have a smart label on it. That smart label we communicate with through Wi-Fi cellular triangulation and Wi-Fi, and at any point we can change or adjust the destination, or if there's a need for rewriting a destination or adding a destination, we can do that in the field, which is not a possibility today with anyone.
It's an extraordinary product. It really is very advanced. How long before it goes into general production?
We anticipate that it'll hit the market sometime in 2020.
So there's still some development to do.
Once it's common. I mean, once a product is engineered and a prototype is built, that's when the real applications engineering starts, and that's where we are at this point. So what you saw today was a prototype. We're excited about it. The market's excited about it. The excitement of all the people at the booth is a further acclamation of the goodness of that product and what it can do. But we will refine it. We'll make it even better than the prototype that you saw today.
Because we shouldn't forget that when we're talking about advanced therapies, each of those advanced therapies, you might be looking at $500,000 worth of therapy. in just one small
Absolutely correct.
package.
And that's the concern, is you have a therapy that is shipped individually, and it is patient specific, and it's irreplaceable. So it may have a dollar value associated with it, but it's typically derived from patient material that can't be replicated, and that patient has a very defined life cycle. If they don't receive that product, they'll likely pass, which is a challenge.
I was very struck when I was listening to you speak earlier today that actually these therapies, they're only one part of access for the patient.
Mm-hmm.
Without you guys doing the logistics and making it happen, actually the patient might not get the therapy that they need.
Well, we've had scientists say to us that, half the problem's inventing the therapy, the other half is getting it there. And that's where we come in, getting it there. But we have to get it there with efficacy. We cannot fail.
Well, there you are. Getting it there with efficacy. You heard there from Cryoport. And look out for that new product, their wonderful blue box.